My name is Dr. Nguyen. I'm a optometrist here. I started with St. Hope in 2023. It started with my dad. My dad had an eye injury when he was younger, and when he came over here, he didn't know that much English, so therefore I had to go translate for him. And then what happened was, when I was translating, the doctor would show me, oh, this is a bleb, this is this, and this is what's going on. So then what happened was I got interested in it because they showed it to me. So now I kind of translate that whenever I see a kid in office with their parents, I always try to tell them, it's like, hey, look at this. And they get really, really inspired by it. So I was like, okay, hopefully, you know, maybe I can pass on that knowledge to another generation. I did my undergrad here at U of H, and then I did my graduate school at San Antonio, Rosenberg School of Optometry. And then I did my training under, I did some private practice. I also did training with the military, and also I work underneath surgeons. And for the past 10 years before I joined St. Hope, I did private practice. But when the kids got a little bit older, I transitioned to more of a community health center. The way I approach to patient care is how I experienced with when I was going around with my dad. I would notice there are different type of doctors. One would take the time to explain to a 10-year-old about an eye condition. The other would just be, here's the drops and see you in 6 months. So I can kind of tell even at an early age what type of doctor I want to be. I want to explain to my patient, not to belittle them, but to explain to them so that I don't need to use jargons to explain to a patient on a condition. I want to let them know what it is, give them the option plan, treatment plan, and let them decide. So I want them to be in kind of informed consent. So like, this is what the way this is and why this happens and everything like that. So that they can decide themselves what the way they want to be treated. I like the mission of you're more than just a number. In practice, unfortunately, there is some aspect of it where it is money driven, unfortunately. You know, so at certain point, I was not interested in that anymore. I want to give back. I want to be more of teaching role, also provide healthcare where people didn't have healthcare, and kind of give back to the community. Here at St. Hope, we provide the routine stuff like glasses and contact lenses, but we also provide medical eye care, such as diagnosis of eye disease like glaucoma, macular degeneration, also diabetes. What's special about St. Hope Healthcare is we're very integrated with the medical team also. So if we need some consultation, we can walk directly over to ask them a question. Vice versa, if they have something consultation about the eyes, they can walk over, ask us right away. And then the healthcare provider can give us guidance, or we can give them guidance if needed. A typical day is I'll go in, I'll speak to my assistant. It's like, oh, we go over the routine of just to prep, see what patient needs are, and to make sure that we're prepared for them. Some patients unfortunately need more time, so we try to allocate more time for that patient. Other patient needs a certain thing that's a follow-up, so we want to make sure that there's no gap in care, and we give them a lot of time they need. When I care for my patient, I want them to take away that they are more than just a number, that we're there specifically for their needs, and we want them to know that we're listening to them, and we want them to know that they're being cared for. When I'm not taking care of my patient, it's family and friends. It's one of those things where I have 3 kids. I have a 9-year-old, 8-year-old, and a 4-year-old, 2 girls and a boy, and a wife, a beautiful wife that I love very much. So I always want to spend time with them, with friends also. So I always say it's not what you do, it's who you do with. So it doesn't matter that I am on a beach in the Dominican Republic or in Galveston. If I'm with the ones that I love, that's what's more important to me. The eye is part of the body, so I think a lot of times we take it for granted, and a lot of times patients don't understand that anything that can happen in the body can happen in the eyes. If you have diabetes, it can in the body, it can go to the eyes. If you have blood pressure in the body, it can go to the eyes. If you have infection in the body, infection can go into the eyes too. So there are things like glaucoma, or even cataracts and things like that. Things like that doesn't cause any damage into the late stages. Unfortunately, what happens is when it becomes late stages, those conditions cannot be reversed. So we want to be preventative of that. So to protect the vision at home, if you're outside, we recommend sunglasses. UV ray can do sometimes a lot of damage to your eyes. The other thing is also just simple things like safety glasses. A lot of times we get a lot of patients, unfortunately, get eye injury by just doing yard work. Fixing a light switch or a light bulb or something like that, something hit their eyes, and unfortunately it can cause permanent damage. For patients who are on the computer for a long period of time, especially nowadays, we're always on a computer or a device, we have a rule, we call it the 20-20-20 rule. Every 20 minutes, take at least a 20-second break, looking at something 20 feet or further away. That helps relax your eyes so that you don't have to feel like strain all the time. Yeah, any kind of medical visit or eye exam, it can be nerve-wracking because you're always thinking, okay, when you come in, there's gonna be an eye condition they found out, and then you know it's gonna get worse and worse and worse. Well, it's one of those things where, like we talked about for prevention, if we can find a lot of stuff early on, if we can prevent it, it doesn't really cause any damage. The good example is glaucoma. Sometimes what happens is we catch glaucoma early stages, we can treat it and we stop it from progressing. Unfortunately, what happens is sometimes we delay it for too long, the damage can be done, it can't be reversed. So I always say get it checked, and then you can get peace of mind. So when it does get checked, you don't have anything, sleep better at night. But if you do have something, know that most of the condition now can be prevented or treated. So to get an eye exam, you can visit us at offeringhope.org or call the phone number on the screen right now.
St. Hope Healthcare, empowering health, restoring hope.